I am Ashley, and I am the Physician Relations Director with the Pain Clinic. It's so great to see all of you here tonight. Thanks for coming. Hope you guys got some snacks or some refreshments. We're gonna go ahead and get started. So Dr. Isparescu is going to come and just talk about spinal cord stimulation and how it helps back pain. We've treated a ton of patients with this life-changing therapy, and we've had a ton of success. So take advantage of the time here tonight. Be sure to ask him all the questions you can think of. That's kind of like the best point for me. It's like you have access to the doc, you know, without having to come to the office, but we want you to come to the office. Ask all the questions that you can. He'll be sure to answer and be super transparent with you guys. And without further ado, here's Dr. Ray.
Hi. Thank you. Can you hear me?
Yep.
All right. All right. Thank you, Ashley, for that introduction. How is everybody? Well, we're talking about pain, huh? So everybody here's probably got their own set of struggles. But thank you all for coming. I'm excited to share this with you. You know, how many of you guys watch that rocket and catch that rocket, right? And we got cars that drive themselves and all kinds of advances in technology, but sometimes it seems like, you know, in healthcare, we're a little bit behind the times, but I do think technology has really drastically improved and given us a lot of technology solutions that we didn't have 10 years ago, 20 years ago. So really excited to share this with you. So let's see if I can figure out this thing.
The other way. The other button.
This button?
Yeah.
Thank you, Edwin. You got to push the right button. All right. So I'm Dr. Isparescu. I'm board certified anesthesiologist, pain management specialist. I finished my training about 20 years ago. So I've worked with thousands of people over the years, and I've dedicated my life to this. So excited to share with you what I've learned in those 20 years. So living with pain can be super frustrating and keeping you from doing things you want to do. Is that right? Anybody to share something they would like to do that their pain is slowing them down from? Gardening. That's a common one up here. So many people are wonderful gardeners and it's difficult to stand or bend. Anybody else? Travel. And I see that a lot. You know, people, you work hard and hopefully you're successful and you look forward to this retirement of traveling and doing these fun things, and then your body doesn't cooperate. Anybody else?
Longer walks.
Longer walks, that's right, exercising. And I think a lot of us have a rosy view of what we're gonna do in retirement, but sometimes pain gets in the way and keeps us from doing those things that we wanna do. So that's what we're talking about. Pain limits your ability to do activities that you enjoy, like garden, walk, go out to eat with your friends, kids' graduation, grandkids things. So our goals for today, number one, I want to talk about what is the cause of your pain. Number two, I want to talk about common medications and treatment modalities. And number three, going to talk about proven treatments for non-surgical chronic back and leg pain. And number four, next steps that are available to take to treat your pain. So I want to talk about a couple of different kinds of pain. Now, pain is not necessarily a bad thing, right? Like if you get close to a fireplace, you know, we talk about, my wife and I used to joke, you have to train your kid not to touch the fireplace, but not your dog. It seems like your dog just kind of senses that it's a little warm, right? So pain receptors are good, right? Or if something's sharp, you say, ouch, you pull back. So that's called nociceptive pain. Those are normal mechanical receptors. Now, as we get older, we get damage to our bones, ligaments, muscles, and then you end up arthritis. It's like, you know, when you're young, everything works so smooth. You look at these athletes on TV, they're incredible. But as you get old, it's like somebody put some sand in our joints, right? They don't work as smooth as they used to. So that's mechanical pain, and that's somewhat normal with age. All of us are going to get it to some degree or other if we live long enough. Number two is nerve pain, and that's called neuropathic pain, and that's where the nerves get damaged. And that can happen for multiple reasons, from nerve injuries to diabetes or chemicals that can damage the nerves. If somebody's worked even military, right? God knows how many chemicals people were exposed to in the military. And so all those things can cause nerve damage and nerve pain. So what's nerve pain? Well, think of it like a frayed wire, right? The wires are not smooth, they're getting crossed and causing nerve pain. So roughly 8% of adults suffer from chronic pain. That's actually a pretty big number. And the lifetime incidence for back pain is like 90%. So unfortunately, this is very common. So that makes about 21 million people in the US suffering from chronic nerve pain. So if you go see your doctor, what are the common treatments? Well, the first one they're going to do is they're going to give you over-the-counter medications. Maybe you can try some Advil, some Naproxen, Tylenol. And then from there, you may be given some prescription medications or physical therapy. And all those options are fantastic. And I'm a big proponent of all those. Those are all very good options to try at first. You know, the conservative options, right? You don't just jump to surgery. So you want to try the conservative things. And a big one that we do is, right, just give it a little rest, especially when you're young. You're like, suck it up, right? You'll get through it. But sometimes that's not enough. So then you come in, see a pain doctor, and you may end up getting some injections. And again, injections are great. They have their role. Sometimes you just need something to kind of push you over to the non-pain side, right? You got an injury, so we can put a steroid or a numbing medicine, block that pain. And that can be effective for some, especially when you combine that with physical therapy. And then from there, oftentimes we go then to surgery. And back surgery is common. I won't ask for a raise of hands, but I always tell people, you know, they ask me about back surgery. I said, well, hang out in our waiting room and just talk to people in there that have had back surgery. So, you know, I joke that I'm naturally biased. I was talking to a primary care doctor, Dr. Lawrence. We were talking about that. I said, well, I'm kind of biased against surgery because, you know, people that have surgery are doing great. They don't come see me. So all I see is the people that aren't doing great. But even if you look at the statistics, you know, plenty of people have had surgery and that's not an option. So then what do you do? So you've gone through all those options, over-the-counter medications, prescription meds, physical therapy, injections. Maybe you've even had back surgery or the surgeon said, hey, you're not a candidate for surgery. So what do you do from there? Well, oftentimes opioids are used and opioids have their place. Listen, if I break my leg and I'm in the emergency room, I'm really grateful that somebody invented opioids. And I'm an anesthesiologist, so opioids, you know, we use opioids all the time to get people through painful surgeries. Now, when you look at chronic pain, opioids kind of lose their efficacy in the long run. They do help, but, you know, I wish it was like a magic, you know, pill that would just take away all pain, because then this room would be empty. I'd be talking to myself if opioids were that magical. And opioids have a lot of different side effects. Unfortunately, 1 in 500 people taking opioids per year die. Now, I will say this, when they're prescribed by a doctor that's doing it the right way, that is not the rate. That is just a national statistic. And, you know, I'm very proud of our clinic record with opioid safety. But nonetheless, the national statistics, 1 in 500 people die from opioid overdose. And then 1 in 3 people end up using or abusing the opioid medication. So I don't need to talk about that. You just need to turn on the TV, right? It's all over the TV, the opioid epidemic. Now, second type of pain I want to talk about, and this is a subset of the nerve pain, the neuropathic pain is related to peripheral neuropathy. So do you have pain that feels like burning, tingling, cold, numbness in your feet and legs? Unfortunately, that's very common, right? People tell me they feel like, actually, I think it's on the next slide, or 2 slides down, but they feel like they're walking on hot coals or pins and needles. So 37 million people in America have diabetes, and about 1 in 10 have this peripheral neuropathy. And about a quarter of those experience diabetes-related neuropathy. So that's very common, just like vision problems, macular degeneration, diabetes. One of the side effects is getting peripheral neuropathy. So it's the most common complication of diabetes, and it's caused by nerve damage from high sugars. They deposit on the nerve endings, and they can cause nerve damage. And this can happen anywhere from 5 to 10 years after being diagnosed with diabetes. So when you leave those sugar levels up high for a while, that sugar deposits on the nerves. and you can get chronic diabetic neuropathy, which, by the way, guess what the best treatment for that is? If you reverse your diabetes and eat the right diet and get your hemoglobin A1C, you can minimize the risk of that. But unfortunately, it's still a common problem with a lot of people, even though they do everything right. So what does it feel like when you have neuropathic pain? Well, you might have feet that feel like they don't warm up. You might get numbness or sensitivity, increased sensitivity at the same time. You might feel like ants or bugs crawling. And by the way, this can be true for radiculopathy. If you have a pinched nerve, right? Anybody felt like they have bugs crawling up their leg? I hear that a lot. May feel like walking on fire or hot coals or walking on pins and needles. So this is a real problem for people that experience that. And again, as we talked at the beginning, it affects your lifestyle. It affects your ability to garden or to travel or walk more, things you enjoy doing. So some of the side effects related to this can also include to the opioids and some of the treatment, short-term memory loss, fatigue, dizziness, weight gain, nightmares. All these can be complications from the medications used to treat the neuropathy. Well, what I want to talk about now is an FDA-approved non-drug option for the treatment of non-surgical or surgical nerve pain. So what is spinal cord stimulation? Well, it's a method of treating pain without using these addictive painkillers that have a lot of side effects, including constipation, drowsiness, sedation, increased risk of respiratory depression, sleep apnea, those kinds of things. Spinal cord stimulation can actually target the nerves that are causing your pain by sending electrical impulses to change how your body processes the pain. So this is actually very cool. Now we're going to we got like 3 slides that are a little bit technical, but I just think it's fun to at least understand how this system works. So the way your normal pain receptors work is you've got a nerve in your hand that's then connected to your spinal cord. So that's one nerve that goes from your hand to the spinal cord. Over there, it connects with another nerve that then sends a signal up to your brain, up to the thalamus. And then from there, there's a third nerve that basically goes in your brain, and that's where you process the pain. That's where your body tells you, oh, I got a pain in my pinky. And by the way, just a little fun, interesting aside. Sometimes when somebody's having a heart attack, they say it feels like somebody's sitting on their chest. Well, that's because the nerve from your chest, right? We don't have very good feeling of, on your hand, you can tell me exactly what you're feeling, but on your chest, those kind of generally go to one area in your brain. So that's where those wires kind of get crossed. So even though there may be nothing wrong with the outside of your chest, a heart attack can feel like that because of the way your body is wired. Did that make sense? So again, this is the way the nerves work. So I just use the analogy of anybody been in New York and going on all those trains, right? So that's kind of your pain signal. It goes from point A to point B, and then you take the next train from point B to point C, and then third train to get to your destination. So again, the spinal cord stimulator works right here directly at the spinal cord level. So it intercepts that pain signal that's coming in. So say you've got a pain signal coming in to your back. It intercepts that pain signal at the spinal cord level, and it inhibits it from sending it up to your brain. Is that making sense? So the spinal cord stimulator uses electrical stimulation to basically block and neutralize that pain signal from going up to your brain. So it stops it in its track. It's based on a theory that Milczak and Wall developed in the 1960s. It's called the gate control theory. And this is the last technical slide, but it's very interesting on how it works. So normally you have a pain receptor or pain nerve called these C fibers that go in to the second neuron at the spinal cord, and from there they go up to your brain. So when there's no outside interference, it just goes right through. Now, when you get the electrical stimulation in what's called these A beta fibers, they can stimulate this inhibitory neuron that then closes the gate. That's why it's called the gate control theory. So it closes the gate that blocks the pain from going up to your brain. And before spinal cord stimulators, when they were FDA approved in the 1980s, this technology has been around a long time. That's how they work, where you would feel a buzzing or a tingling. The example I want to use there is even a little kid, if you bump your knee, what's the first thing you do? Is you rub it. Why in the world would you rub your knee? Would that make it the damage from hitting your knee better? The answer is no. But even a kid knows that when you rub it, it feels better. Why does it feel better? Well, it's because you're stimulating a neutral stimulation. This is just on your skin, but you're using this neutral stimulation over here to basically block the pain from getting up to your nerves. This actually gets a lot more complex, but even the way we discovered opioids is your body has a natural endorphin and enkephalin system. Anybody heard of runner's high? All right, you remember that as a kid, you're riding your bike or you're exercising, you just feel fantastic. You literally feel high because your body is giving you a natural shot of morphine, of opiates that your body can make. So that's where the opiate receptors come from. And when you take a narcotic, they're basically mimicking the opiates, which basically here act at this neural junction here to inhibit the pain signal from going up to your brain. Is that a little too complex? Back me up or ask me questions if I get excited about this now. But you know, because this is how opiates work. This is how they discovered. Actually, I trained at UC San Diego with a guy named Tony Ox. That's the one that discovered the opiate receptors in the spinal canal. So if you've ever heard of an intrathecal pump, he's the whole reason they decided where they put morphine in the pump, or if somebody's getting a spinal for surgery, they'll put a little morphine or fentanyl in there to block the pain receptors at the spinal level. But that's basically the gate control theory. You're blocking the signal before it gets up to your brain. So what is spinal cord stimulation? Well, it's been around for a long time. It was in 1967. It was first tried on animals. They first came up with a theory. And I believe in the 1980s, 84, if I'm right, it was first FDA approved for humans. And so it's been FDA approved for almost 40 years now. So the system consists of, think of it like a pacemaker for your back. So it's the same technology. Generally, the same companies that make spinal cord stimulators make the spinal cord. The same companies that make the pacemakers make the spinal cord stimulator. So it's similar technologies. You've got a little battery, and then you've got wires that go to your spinal cord. When they were first made, they didn't have rechargeable batteries, but now, like everything, they have rechargeable batteries, so they're able to put a lot more juice out because they are rechargeable. So how does it work? Well, generally, before you have a permanent implantation, you get to try it. So we usually do a trial for about 1 week, plus or minus. So we insert these wires into the spine, into the epidural space. So anybody had a wife or a kid that had an epidural with having a baby, right? It's the same. In that situation, you're placing a wire that gives a drug. But in this situation, we're putting a wire that has electrical stimulation to stimulate the spinal cord. So you place that for about a week, and then you try it out. And like I was saying earlier, Nevro, the company we've been using the most, has a very unique this HFX technology that is incredible. They're using a very high frequency that you don't feel. So before the spinal cord stimulators, you'd feel a buzzing or a tingling down your leg. Well, today you can, they have it where you don't even feel it. So it's what's called subperception. So some people found the old simulation annoying. So this device can do that type of simulation. But what we find is most people don't use that. They prefer the high frequency that they don't feel, and it works incredible. Think of it like you ever go to what's that, like a SeaWorld, and you watch the shows. They have a little whistle that you can't hear, or you barely hear. So it's the same idea. It's above our perception, but it's effective, and your spinal cord knows it. And then so that's where we do the traditional or low frequency SCS, mask the pain. by inducing tingling feelings where you experience the pain. So this new Nevro HFX 10 kilohertz is again subperception. It's outside of that range. So let's look at some more data about it. Nevro HFX is a non-drug solution. It was originally FDA approved in 2015 for back and leg pain. And let me tell you, I think in the market, it's made a tremendous difference. It's become, especially in the Northwest, probably the most popular option for the spinal cord stimulators because patients really like that subperception pain where they don't feel subperception stimulation where they don't feel it. So right now they've treated over 100,000 patients since then. And so their numbers are very big, and basically their pain relief is 76% of patients that try it get a substantial, long-lasting pain relief, whereas with the traditional spinal cord stimulation is only 49%. So now you can see why it's become so popular, because it's been very effective. More than three quarters of people do very well with it. And this is for chronic pain, chronic back pain. So 8 out of 10 people enjoy significant pain relief. Some more awesome things about it. So pain pumps used to be, anybody heard of a pain pump? And I think they still have their role, but they used to be really popular, but you have to fill them every month and just a lot more maintenance. So the beautiful thing on these, there's no, you don't have to, once it's in and it's working well, they may have to reprogram it, but in general, you're good for about 10 years. I think they are warranted for 10 years, right? We got our reps from the company in the back, but they're warranted for 10 years. So there's no restrictions on driving, no sleep restrictions, no uncomfortable stimulation, convenient charging, 10+ battery life, and no tingling or prickling. And now they have the IQ, which is kind of the next generation, which is they're using AI, and they have a cool app. So it's much more interactive and you have much more control yourself. So before you'd have to meet with the rep and they would have to make different changes. Now it's much more interactive for the patient, and it learns from you. It figures out which programs you're using and which ones are best for you using their technology. So what would 50% or more pain relief mean for you? Could you travel more? Could you garden more? Could you go on longer walks? Would your enjoyment of life improve? Now I want to switch gear just a little bit. That data was specifically for chronic back pain and leg pain. But now let's look at the diabetes pain. So this slide actually shows it's recommended for by the American Diabetes Association and American Association for Clinical Endocrinology. So the average pain relief for people with diabetic peripheral neuropathy is 77%. And again, 80% people get significant long-lasting pain relief. So who's a candidate for the diabetic neuropathy? Well, obviously, if you have diabetes and you have a diabetic-related neuropathy, if you've tried at least 2 medications and still suffer from pain in your feet and legs, and if your hemoglobin A1C is less than 10%. So this here shows a graphic of the spinal cord stimulator trial. And actually, we have some of the devices here. This is the one that in the trial that they're showing a picture there, gets taped to your back. And then these wires, these leads, plug into the machine. And then these go up into the epidural space. So again, just like, you know, a mom would get an epidural for a baby that would put drug through this. This delivers electricity. And it's a wire that sticks out of your back for a week when we do the trial. When it's permanently implanted, then these wires get connected to this little battery, and this is life size, and it's about the same weight. And I actually have a real one here. This is actually a real one. So these are the ones that get implanted, typically in lower back, in the flank area. Here's a trial. Let's see. Edwin, is the sound connected to this? This is a person that underwent a trial last week. Do you have to push play?
One more
So I
time.
push down. Okay, I'm learning this technology.
Yes, good evening. My name is Patty Bell, and I had my trial for my spinal cord stimulator 1 week ago. And I can say that it was life-changing for me. I couldn't walk around the block of my house. I could do that. I was able to stand and cook a meal for the first time in a year. And my pain was decreased by about 80 to 85%. It was life-changing. Hope you'll have the same results as I did. Thank you.
So, so who's a candidate for those? People that are diagnosed with chronic back and leg pain, people that aren't candidates for back surgery based on a surgeon's assessment, people have tried multiple medications, people have tried multiple procedures. So obviously this is not the first thing you do, right? When you come in with pain, this is not the first procedure we do. But if you've tried all the other ones and you still continue to have pain, this has been a great option for a lot of people. So, you know, we promised a real living
Testimony.
testimony here. So which microphone should we use? He has it. You want to come up here? You may as well.
Sure. Like, I was in the Army for 18 years. I was a drill sergeant for a while, so I'm pretty good at projecting my voice. I'll use a mic if you can't hear me.
Use the mic.
All right. Push. Hello, hello. Hi. So my name is Tel Thompson. I'm actually from here, born and raised in Clark Fork. I'm a Bonner General baby. Joined the Army right out of high school, went and served my country for 18 years. And unfortunately, I got hurt during a training exercise. The Army in their infinite wisdom said, "Thank you for your service, go away," and retired me and sent me home. In the 3 years after coming home, life was hell. Everyone's here because they're in pain, or their family member is with them because of the pain that they're dealing with. The VA's original option was just fill me full of pain pills. I was not a fan of that. I didn't want to live in that fog, that haze, that constant drowsiness. And I have a life to live. I have young kids that I want to be around for and actually active with and do stuff with. And frankly, when you're in pain, you're kind of an ass. I'm not as poetic or eloquent in my speech, but I was not a fun person to be around. I really wasn't. I was always in pain. My kids didn't want to be around me. My wife tolerated me, God bless her soul. But it was horrible. Finally went to the VA. It's like, I can't keep doing this. What are some other options? I got referred to the pain clinic. I saw Dr. Esperescu several times. We did the injections and the nerve burnings, but those didn't really seem to last too long. About 4 to 6 months was about all I was good for. And then I would have to get it done again. Well, then insurance and VA does what they're gonna do. And they said I could only get it done once a year. So then I was back to the pain pills. And that's not how I wanted to live my life. I'm assuming that's probably not something you want to do, which is a reason why you're here. A year ago, I was in these chairs, listening to Dr. Esperescu and the staff talk about this procedure. When I first got the test run, the trial run, I did not want to give that thing up. It was amazing. That week in itself was great. I finally was able to get sleep at night, not be constantly rolling over in pain and hurting, even getting up, moving around. I rarely use my cane nearly as much. It used to be an absolute mandatory item for me in order to move around. I have no feeling in my left foot, so it's more for balance now, but that's an Army issue from getting hurt, not the device. The device was life-changing. I used to do competitive bodybuilding with my wife. 3 weeks before I got hurt, I was in the best shape of my life. Then I got hurt. I put on quite a bit of weight. Since I got my procedure done in March, I've lost about 45 pounds. I'm able to get active again. I went hunting again. going up in the mountains. I have to move a little bit slower than others, but that's okay. But I'm able to actually be active. I go to all my kids' sporting events. I couldn't sit on a bench for more than 2 minutes trying to watch a game without almost being in tears because it just hurts so much. I go to all my kids' games. We go on walks. We go on hikes. It's a little bit slower for me, but we still get out there and do stuff. I'm able to, I'm not in the pain. That is the big thing. I am not in the pain. My family has immediately noticed the difference. I don't have this look of constant pain or agitation on my face because I was always hurting. I'm able to get back to a lot of things that I enjoy doing. I'm a lot more easygoing, happy-go-lucky, fun, loving type of guy. That's what I like to do. After living in constant pain all the time, man, life is good. I am happy to be alive now. I am happy to be able to be up and moving around and standing here talking like this. When they called me up and asked if I'd be interested in coming to give a live testimonial, absolutely. These guys are great. It really did change my life. I am back to enjoying life again and actually living. You know, I don't feel any of the tingly, like how they're talking about the old systems. I have family members, elderly family members that have the old styles and they can constantly feel the tingling and everything. I don't feel anything. It is completely on my subconscious or my non-perceived level. And the battery lasts several days because every now and then I get foolish and I forget to charge my back at night. So it's really simple. It is real easy. Here's my charging pad. I watch TV with the family or I read a book and I sit on my pad and it charges. It's really easy. It's really simple, about 15 minutes a night and I'm done. If I forget and go a couple days, it takes a little bit longer. I've never gone under half a battery, but I start getting a little worried and then I put the battery charger on because it tells me how much battery life I have left. It's like, oh, wow, I still got 2 full bars. I'm good. I better charge this before I do something silly. But this is a game changer. It really is. I can't express how great it made life to live again and actually be out there and doing stuff. I can run my family's business. I can play with my kids. I can hang out with my wife. I'm not in constant pain. And that means everything because pain sucks. It really does. So, but otherwise, are there any questions, anything I can answer? I have it.
So how do you know if you're having new pain symptoms? Does it overshadow everything? So you're,
Oh, no. Oh, no. If I do something silly, I'm gonna feel it. It's not gonna erase pain. If I hit my leg, I'm gonna feel that pain. But what I don't feel is the constant pain that was in my lower back. And so I had an L5-S1 injury or L3, L4, L5-S1 in that whole area. And I had pain constantly down my leg, in my back. I lost feeling in my left foot, but the pain was always there. If I work extra hard or if I do something, like say if I'm being silly or doing something dumb, I will feel a little bit sore that night, but I don't have that pain that I did where if I did something wrong or I twisted wrong or, oh, I can grab this real quick and bend down and pick it up, I would be in pain for a week. Now it's like, oh, okay, oh, hey, ooh, no, I'm good. I can do this. Anything else I can answer? Yes, sir.
Do you also go to a spine specialist to find out whether your condition is deteriorating?
So I do have degenerative disc disease and I think they call it spinal. My discs are thinning and disappearing and all that stuff. I do have that condition. Yeah, they were very surprised at doing the stuff I was doing in the Army. I didn't get hurt sooner, but So, the neurologist, I saw in the army, he did 3 surgeries on my back. And then I couldn't get another doctor to touch me after that when I got retired. So further surgical options was not available at all. No one would touch me. But I don't have any other new pains popping up. I really don't, and it doesn't overshadow other pain either. Yes, sir.
Where do they put it? Like I have low back pain, but I also have my neck infused.
So
Like, where do they put it in placement of where your pain is?
so they have the ability to do that, and I'm gonna give him the mic for that
And
answer.
I have a mic. You
Okay.
can stay here. You don't have a seat anymore. Where do you want to sit?
I'll just pull it over here.
And by the way, you look fantastic. I haven't seen you in a little while, which is cool. Last time I saw you, I mean, I'd seen you a lot of times and your face would be red and I could tell he was, he's a young guy. And when you're young, you, with young kids, you want to be out there living life, doing stuff when you get an injury. So I'm sure there's a component of anger.
Oh, yes.
At the military, at the bad luck you had, at whatever, right? So now you're just,
Life's good.
life's good. So anyway, I love that. So, the question was, where do you place it? So, we have algorithms, for, if you have leg pain, we'll put it a little bit lower. If you have lower back pain, we put it up a little bit higher, basically mid-thoracic area. We also use it for arm pain. So we can put it all the way up to C1, C2. We did one, was it yesterday or 2 days ago? We went all the way up to, just above C2. So,
If you do it at like C2, does that just affect like your neck? and
Yes.
Your arms? It
yes,
doesn't affect
because this one's
anything?
specific. But, we put in 2 leads. This gets a little technical and nerdy. But,
We can handle it.
good.
Thank you.
Well, I like it. I just thank you for it. Sometimes I get too excited and get too technical, and so I try to.
Here to learn.
So we have, you notice each of these has 8 different contacts. And so typically what we'll do is we'll stagger them a little bit in the spine, but we'll still put these based on where your pain is. We've even done for thoracic pain, like I got a patient that had a cardiac procedure. Believe it or not, open heart, sorry, just another random fact. Open heart surgery you would think would be worse, but when they actually cut the ribs or split them, that can end up with chronic pain. So we've done those in the thoracic area, kind of the mid-thoracic area for chronic pain there, and then of course for pain in the arm. But I think the FDA rules are you can have 2 devices, so but you have to put them in 6 months apart. So 2 separate, but so typically you choose neck or lower back. But if you want to have 2, you can get a second one sometime later. I have done it where we stagger. We can put one up high and one down low, but I like to have 2 leads because that way, if you move around a little bit, you kind of have a little safety, you have a broader coverage.
If you have a damaged, like I have a damaged spot on my cord, which
Okay.
makes a nerve pain down my leg all the way to my foot, does that mask that then?
Yes, it can
Even though
mess
there's
up,
a-
absolutely. But if we know where the pain is coming from, like if we can pinpoint, hey, the pain's coming from this area, absolutely.
How do you pinpoint? You said if we can pinpoint, how do you do that?
Well,
I had a really bad spot, so mine is.
yeah, so if we know that's the spot, but typically we go based on symptoms. So if his symptoms are down the leg, then we typically are in the like T8, T9 level. T9, 10 is actually their magical spot where they want me to have these over T9, 10. So that's typical for back and leg pain. If it's leg pain, sometimes we'll cheat down a little bit lower. If it's more back or upper back, we'll just cheat up a little bit higher. But if it's neck pain, if it's like arm pain, then we'll be way up in the neck. And that's a different lead, so that's, I'm just gonna use it as a model. But, they'll literally be up here, the top of the lead, versus typically we put them about here.
How does it get inside?
Well, we have, just like an epidural injection, you basically put a needle down here and through that you thread it up. So it's in the epidural space. Thank you, Michelle, for using it as a model. Yeah, That's what I do all day long. I do lots of epidural injections. Many of you probably had epidural injections. And if you've had like I said, a wife or a sister or a daughter that's had an epidural with pregnancy, it's the same technique. You just sit in a chair and they come in while you're having a baby and they put it here and they usually thread it to mid-thoracic level, typically for an OB epidural. So you just thread it up gently. We use X-ray machine to guide it, so I'm watching it, you're steering it. Yes, you have another question?
Yeah, I know it's not a TENS unit, but for somebody, maybe I'm not the only one in here, a TENS unit, I've used it from the neck and the back since the 90s. I love my TENS unit, but it does do nothing for my leg pain. So just generally speaking, not diagnosing anybody, but how could that help leg pain if TENS units helps you really a lot for different kinds of spinal pain, but for whatever your reason is for your pain, whether it be diabetes, nerve injury, whatever, that TENS unit doesn't do anything for it. How will you know that
So-
this could be different?
It's the same technology. If we go to that slide that showed the gait control theory, just like rubbing it is almost like a form of like a TENS unit that helps. A TENS unit can stimulate those nerves, but this actually goes to the spinal cord. It actually goes to where those nerves are meeting. That's where the nerves connect, you know, from your arm or from your leg to your back. So you're putting it right at that junction and it actually penetrates the electrical, you know, waves deeper into the spinal cord than any TENS unit had. Yeah. And now they have even, for somebody who has a specific nerve injury, we even do peripheral nerve stimulation. So if somebody has just a very specific nerve, we can put a peripheral nerve stimulator, which is a different device, different technology, but really cool for somebody that's got a very specific nerve injury, like in the calf or brachial plexus injury. So it's just, today there's many more options than there were. You know, like I said, I graduated medical school in '99. I finished my pain fellowship in 2004. So since then, a lot of this technology's come out. So the spinal cord stimulator has been around, but they've made so many advances. The technology is way better than it was. I don't know if any of you guys know somebody that had it 20 years ago. It's day and night difference from today.
Oh, and customer support is awesome. They called me all the time. After surgery, I got called up. So, oh gosh, I almost felt like every other day is what it felt like. But it's just a quick check-in. I shoot text messages to them. When you get your device, it comes with a cool little remote that looks just like this. I brought mine with me. And getting it dialed into that right spot, when you find that money spot, that is great. That's about how much stimulation it's actually giving and helps override everything. But like that gentleman back there, yeah, I talked to him a lot. So he probably got annoyed with me, but customer service was amazing. And if I ever had a question, they were always there to answer.
And that's a very big thing for me, because like I said, half the work is engineers coming up with really cool and good technology, but the other half is really customer support. So they do a phenomenal job of that. Yes, I'm sorry, the gentleman,
Yeah, he was-
sorry, yeah, go ahead.
Would you show us your scar?
Sure, I got a couple.
We just want to see your muscles.
Oh, well,
Take off your shirt.
this is a good part. So I already had 3 scars on my back from the previous back surgery.
There's 3 scars there,
Right.
and then one across here, which is where the.
Where's the battery sitting in for
So
you?
the battery right here.
Okay, you can see it perfect, yeah.
If you can get up and personal with them and he'll let you, you can actually feel it.
Now that battery lasts 10 years, but you have to charge it every 2 or 3 days.
Yeah.
Okay.
They do make
Yeah.
non-rechargeable ones that last anywhere from 2 to 5 years, depending on how much juice. Well, what numbers would you say? The reps are back there, and even Grant, wait, Grant.
Hello.
Grant's been in spinal cord stimulation. I met Grant when I first moved up here like 18 years ago.
Yeah.
Actually, before we moved, he and I talked. So he's been in this business a long time. And so he's seen the technology just drastically improve. But yeah, this is what's buried underneath. Sorry, yeah,
So you adjust the whatever until you start feeling better. If you
yes,
actually are feeling better, is it still on?
yes. You
It's
leave
on
it
all
on.
the time?
This technology is very interesting. The old technology, you would like, you know, turn it up and you'd feel it. So yeah, but this one, but it would be more instant. This one, there's like a wash-in period. It takes like a day or two for it to really kick in. So it's very interesting.
So the noise or the frequency is always kind of giving you something,
Yes,
not just when you actually
right.
have the pain and then it comes on kind of.
24/7. They do have different programs. I say it's like a remote control on your TV to the old school TVs, because TVs are now, anyway, I don't know, TVs, but the old school TVs, remember, you can turn it on and off, you can turn the volume up and down, and you can change the channel. And by channel, it means they have different programs, and these ones, I'm 32, and the new ones have what, like 164 or something?
35 with this one, and then pretty open-ended.
Yeah, so I mean, you got like more programs than you would have time to go through, but it's got different programs. So say you have two different kinds of pain, and that's where the newest devices that just came out, they actually, it'll track which one you use, and it can actually mix the programs. This gets really nerdy, but they can actually, if there's a program, say for your foot that you use, and then there's one for your back, and it can actually mix those two programs. So am I saying that technically correct?
Oh, yeah.
All right, so it pays attention to which one you use, and then they can blend it. They also, with the device he's got, they actually can track that, and they can mix it too manually, but the new ones will do it automatically, so.
So it's not gonna be like a phone where in a couple of years it's like,
No, the technology is,
yeah, that's what I wondered,
It's-
it's like,
well, like everything, you
Yeah.
know, in 2 years, but I wish technology moved faster in healthcare, but because of all the FDA, I don't even know, I think it costs like $1 billion to bring a drug to market. So if they want to change the color of the wire, they have to literally like go to the FDA. So even dumb changes, sometimes I'll be like, why don't they do this? But it costs them like 200 million. So, but they do improve probably every 2-3 years. They have like a substantial improvement, and they can, there is back, you know, they can add some of it to the older devices. But of course, there's some stuff that's only in the new devices, but that's true of anything. You buy a car and in 2 years, like, oh, there's a better one.
not all of us.
So that's the device that you had in your
Yes,
hand?
this is a dummy one, but this is an actual one.
So it's kind of, no, when you're talking about implanting near the neck or something, I was.
No,
thinking,
the wires go in the neck.
Oh, just the
but we
wires,
implant
but
it
it
here.
always,
You know,
it always goes in the same.
Yeah, pacemakers go up here,
Okay.
but usually we put these on the flank, and most people have a little bit of love handles there, and so there's kind of an area between the hip and your and the ribs that we try to kind of get it in. Yeah, any other questions? Yes.
Are there any restrictions on water sports or anything along those lines? or-
No, it's no restriction on water sports. For the first, I like to say 6
After
months.
healing,
Yeah,
after healing.
for the first 6 months, because every time you bend, these wires can, you know, they're anchored down here, so when you bend, it'll pull them down. And so we really want people to limit for at least 6 to 8 weeks, but I always try to push people for about 6 months. I don't want you know, bending, because it can pull the leads down. After 6 months, then they get scarred in, so they're almost like they ride on rails. So as you bend and move around, then they'll adjust.
Do they look at you funny at airports?
So, my wallet is up there. I actually have a little card that goes with me everywhere. For airports, and if I go to the hospital, it's part of a medical alert card I have, just to let them know it's there. So, I've flown with it, no worries. I just showed my card because they had to stand there, do the whole scan thing, and it's like, I promise it's not a bomb. Here's my little card. I know there's a device and wires, so.
So they hand push you through, you don't have to go through X-ray machine.
I had to do the stand spinny one that they do. I haven't played with the metal detector. Could be fun.
You know, I'm curious from the reps, do people have issues going through metal detectors?
No.
No, yeah, I think these things are non-ferrous. Sorry, another cool thing, 20 years ago, none of these were MRI compatible. Today, they're full body, head to toe MRI compatible. So that means the metals they use are non-ferrous, so they don't set off the metal detectors. Because they're using because otherwise, if it was magnetic in an MRI, it would fry you. So all these are full body, head to toe MRI compatible. What's that? Yeah,
No, you talk about it being a high frequency that we can't hear it, but do animals, dogs?
This is at the spinal cord level, you don't hear it.
They don't hear it either.
I just use that as an example of a frequency. that-
Okay, good.
No, yeah, animals
Alright,
that don't hear.
well
it.
controlled.
I said my cats cuddle with me. I'll keep that.
Yes, yes, ma'am.
By Medicare.
Yes, Medicare, Medicaid, is a more of an issue, but Medicare and all the private insurance is covered. Like I said, this technology has been around a long time. It's not, brand new, so it's well covered. And it's got lots of data to show it's effective, because if it wasn't effective, and you saw those numbers, 76% for the or 77 for the diabetic peripheral neuropathy, and like 80% for the, leg and low back pain, so pretty incredible. And that, those are big numbers with 100,000 people, so they're not like little studies. Yes,
You talk about leg and back pain, what about hip?
it can work for the hip, absolutely. Just, from the waist down.
Yeah.
Yeah, it can work for hip pain. Yeah, that's a common one. Yeah.
Sorry, I got lots of questions.
Yeah, go for
I'm,
it.
I'm young and I got a lot wrong with me, but I got a lot I want to do, so.
Wonderful.
When you decide whether you want to do like a nerve burning versus something like this?
I would absolutely try the nerve burning and try all those things first. I always recommend, try the conservative things, right?
I did nerve burning several times.
See, and I've never did any of that yet. They just kind of said I'm kind of stuck with, means I have the dent in my spinal cord.
I'd go see this guy.
He's giving me lots of shots.
Okay, so
Yeah,
he's done my shots. He did the nerve burnings
Yep.
for me.
And I've been going to Dr. House, and I'm on just a high dose of gabapentin, and that definitely helps. Quite a bit, but my foot's always burning.
I'm with you. I was on max dose gabapentin for years.
And did it help some?
It helped some. It did.
It makes it tolerable for me.
Yes,
Just-
that's a good, it was tolerable. I could get through my day. As I was getting through my day, I was just getting by.
So
What was your
obviously.
next dose?
3,600 is.
Yeah, it was like 3,600. I was taking four pills 3 times a day.
Okay.
And yeah,
Did you try the long last or the slow release one?
we tried so many different cocktails. It was amusing. I had a pharmacy just for me in my house. It was horrible.
So we want you to try the more conservative options first. This is not like your first day of pain, you get this. But
Did your neurologist ever suggest to you that you might get fusion?
I am fused, L4, L5, S1.
Yes. No.
Yep, I am fused, and that didn't, it was not the cure all he said it was gonna be.
My
Mine
dad-
told me that he could fix my back, but I wouldn't like him after he did it. And that's what he was suggesting was a fusion. And then you start losing mobility,
Yes,
and that's why I didn't do that.
I did the fusion, and I don't like him, and it didn't necessarily work for me. That's me personally. Yeah, I did not get the relief that was promised when I agreed to that last surgery with the Army.
there's a time and place for fusion, but fusions typically, they really mechanically, structurally change the way your spine moves. So I'd say with the fusion, it's almost like you start a clock. And if you're lucky, you might get 10, 15 years out of it. If you're unlucky, you might get 1 year and then be worse off, so.
My dad he was fused, and within a year, it affected above and below where he was fused. So
The
he
analogy,
moved forward with the stimulator last year. And he had pain down the back of his legs was his complaint. It didn't come from the back, but that's completely gone. I mean, that was gone with the trial, so once he had it placed, he's same as Tell, you ask him and he says, it doesn't hurt at all.
that's awesome. I'm so glad to see. Chris is another local Sandpoint. Born and raised, or your grandparents were here, right?
Ridley Village.
Ridley Village. So anyway, she's another local, so it's wonderful to see her dad doing much better, so.
And I'm not just saying this because they asked me to come and I had it done. I've been ranting and raving about how much I love this since I got it done. A gentleman here that I know, he was like, oh, this is what you're talking about, because I love this device. It has seriously made all the difference in my life. It really has. So why when I was in at my last checkup, it's like, if you need someone to come talk about this, I will be there. You just let me know when I am there. And here I am.
How long ago did you get it?
March. And yeah, post recovery was a little rough. It was a little rough at first because the device isn't really kicked on and you have to heal. It was a surgical healing was rough for me personally. But when that was done and I was healed from the actual surgery part and past my don't bend, reach, or lift or carry, implementing my restrictions. Oh yeah, it's been wonderful.
Yeah. Go ahead.
Many questions still had here. One of my massage people was asking about what about dislodging that?
I can massage, I can answer that. She's gentle around my device itself only because it feels weird, but I've had no repercussions.
I'm more worried about what the doctor says there as far as manipulation of the joints and stuff there, especially the sacrum. So I have an
If you look at,
issue there.
if you look at the way the device is anchored, let me just see if they actually have a picture here. Okay. So the device, so we put it, when I insert that, we put a needle that goes into the epidural space and then we thread the leads up. Well, they get anchored just above the lamina here. So they're anchored deep down inside. The only way you can dislodge it is by really doing some crazy twisting or something like that. So they're secured. So you can rub all you want. There's no way by massaging it, you can dislodge it. I mean, I guess they never say never, but I don't think anybody would allow somebody to massage them that strongly where you would dislodge these.
They
And then-
said that the ones that they had worked with were that had been more just motion stuff where they hadn't been doing hands-on pushing anything, because I guess once you get mobility, it's more just, I don't know, what is your therapy now? You say you get massage for your pain probably?
Yep, I still get massage. It helps with a lot of our pain, but one things I noticed when this pain went away, I'm a little banged up from the army. I have other things that I'm like, oh man, I've had surgery on both my shoulders also, and I got a little banged up here and there on deployments, and I have other aches and pains which they tend to help for, but when I used to only go just to help deal with my back and the pain running down my leg, that's not the concern. That's not why I go for a massage anymore.
Well, they're saying that maybe if this works, then it's gonna release a lot of those muscles that I have there.
Oh yeah,
And then I won't need as much work done.
true story.
So, and my other question is, I've seen you walk down comfortably, started using your cane back and forth across the stage for a considerable period, standing. How do you feel?
I feel
I mean, I can see
wonderful.
kind of in your face that you've had a little bit of pain, but then it goes away, so it's working while
Oh yeah,
you're
it's,
here.
yep. I don't have any balance. I don't have balance. I don't have feeling in my left foot. It's just kind of there.
Mhm.
So, I hurt from other things, but not my back. Is the best way I can put it. I have other aches and pains,
Oh,
but
boy, I bet.
not from,
Yeah.
not from when I hurt my back with the army. And the VA did pay for this. I don't know if I was the first VA that paid for it here in Sandpoint, but the VA did pay for it.
Yeah. The VA's been doing these a long time. When I did my training,
Oh, okay.
So the VA, like I said, it's not a new technology, but. Yeah, and you can continue to get massage for muscle things and other issues.
Well, I
But
don't know, you write the script, so. Okay, gotta get that tape there.
I mean, I encourage everybody, getting massages you can afford or your insurance will cover.
What are
I
your,
will say, I'm a medical assistant at the clinic.
Adrian's been with us 6 years or 7.
That's the one.
Almost 7.5, 6.5, but I saw Tell when he was getting epidural steroid injections, and then we did the MPBs and the RFAs, and I literally just told Bryden when I saw him walk up on that stage, I was like, he is walking so well.
It was
because he
impressive,
so
yeah.
thin. He was so
Same, Kane looked a
slow,
little short.
in pain. He looked so good. Yeah, so he looks amazing, and it just night and day difference from seeing him before to now.
Dude, now we don't see him as much. Before we used to
Yeah, I
see him all the
know.
time.
Yeah. I had the cane that came up and wrapped around my arm and would have the handhold and,
Mhm.
yeah, that was, if I had any actual walking I had to do, that is what I would use.
Mhm.
I'd use my other canes just for the quick little spurts and it was heavily reliant upon just to move around. Now, it's just more so help keep me from falling down and I still lean on things because I don't have balance and that's what most of it is for, is being leaned on.
Any other questions? Yeah, go ahead.
do you take any of your gabapentin or any of that
No.
anymore?
No, I have not taken any painkillers since my surgery. Yeah, that's a huge thing. I've not taken any painkillers. Tylenol and aspirin here and there, but for other things, but yeah, I don't take gabapentin anymore. I don't take my painkillers anymore. Yeah, can't begin to tell you how happy that makes me. Like, I'm not falling asleep just sitting there because I'm so doped up or gabapentin made me super exhausted all the time. That and the muscle relaxers and just a whole cocktail. It's like, how do people function? And I can look back and like, oh, you function because you have to. But it's really nice when you don't have to take the cocktail.
Go ahead.
Is there a reduction in effectiveness over time with the spinal stimulator? In other words, when you're getting out at 8, 9 years,
I think we have plenty of people. I'm sure there's a little bit of reduction. There's probably a reduction in pain for everything and we get older, not younger, so you have more issues. But I think they have this data out to 5 years.
so in our published data, it goes out to 2 years, but we keep track of all of our own data. And so anecdotally in the area here, a large majority of the offices that use Nevro are staying right along the national average of 76% responder rate and well beyond 2 years. What's the science behind that? The body tries to regenerate itself. So if you're blocking nerve pain, I can see the nerves conspiring to say, we want to reestablish that.
Right.
So what's the science?
Well, that's the gate control theory, but you're right. The body usually tries to adapt, but it seems the high frequency seems to work well and work well in the long run. Yeah, and it's been a game changer versus the low frequency.
And I think we've seen quite a few patients that have had them for quite some time.
Yeah.
We saw one patient that had them and then was in a car accident, I believe, and it moved them, and he was adamant that he had it replaced and redone. And I think he had it for like 10 years.
Yes, you're right. They had it for like 10 years. Well, actually, yeah, 2014. Yeah, 10 years. So they had it for 10 years. And then we have another gentleman that he had the neck, he had one in the neck and one in the back. And he had a different brand before. And then he'd had it before me. I replaced him once like 8 years ago. And then that one, the batteries died or whatever on it. So we replaced it with the Nevro system and he is loving life.
So that guy that has the two, is
Yeah.
it from like one accident or like from one time and something else?
It's been a while.
Does that matter? Like mine are
He's an
two
older
different
gentleman, and
times.
so I can't remember if he had and recently he had a car accident that dislodged them both, so that's the reason, those both got moved, so we just replaced the whole thing. Cause they've been in there for a while, so why would you put one they have to replace next month? So we just redid the wires, brand new systems, and we switched them to Nevro, and he's doing awesome.
But I don't think I would.
He lives far away, cause I wanted to have him here tonight, but he's not that close to me.
For Brandon's question though, I don't think it matters that, are you saying like the injuries were at different times?
Yeah,
That would,
Oh.
it wouldn't matter.
so like my lower back is just from doing stupid things.
Yeah.
My neck is from getting stolen. So it's like I have leg pain from my neck, you know, but if I overdo it, my lower back fires my leg up too.
Right, so like she was saying, you could get one for each. Sometimes it's tricky if there's a work comp and only one of them is work comp, they'll cover one area but not the other, you gotta go through regular insurance. That's all insurance games we gotta play at times. Did you have a question?
Oh, it was more of a comment, just that I met Tel about a year and a half or so ago. And I don't see him very much, just a couple of times in that interim. But his mobility from the first time I met you to now is just astoundingly different. So, I mean, I'm very happy for you.
Thanks. You are night and day, because I remember your face would be red, you'd be like sweating in pain all the time and now you're relaxed and happy and it's wonderful to see. Any other questions? Yes.
So you said if you're not a candidate for the surgery, that you're a candidate for this. And
Yes.
my surgeon has said that he could do another fusion and one, and have 2 back surgeries.
But and I would put the criteria as, not a candidate or don't want to, because we get that too, where people are just like, I've been there, done that, I'm not doing it, or like, hey, my cousin's brother's uncle had it and I will never do that, so that's another reason for it. And it's obviously far less invasive than, and these are easy to remove, say something happens, whatever, you
Now,
can.
you said the recovery from the surgery is not so great.
I made a choice that I was not gonna be taking any more painkillers. And it was swollen and sore. I'd gotten cut and a device shoved in and it swelled up about the size of a grapefruit. But in my mind, it felt like it lasted forever. My wife noticed a difference within 2 days. She says I'm a baby at times, so I'll take her word on it. Yeah, exactly. I do have that handicap going for me. But yeah, post-surgery is surgery pain. It was not fun, but it didn't last nearly as long as in my mind it did. But well within a week, the surgery pain was gone-ish for the most part. If you've had surgery, you know how that is, but yeah, after that, when we actually got the device running and things were going, it was a noticeable difference. And it's not a night and day. It's not like, oh, we're gonna turn it on and your pain's gone. It's a slow, it takes a day or two to kick in. It's like when you make the adjustments, we'd make the adjustments to find out what program I should be at and what level. And we'd give it a couple days and okay, hey, this one's not working, let's up it a little bit, or oh, this is too much, because if you have too much power running through, it's counterproductive. It's not going to do what it's supposed to do. So it's literally finding that right level that's perfect for you. Yeah, I found my sweet spot.
And I'll just give you, typically it's about a week surgically to recover, as with any surgery. You know, if somebody had a pacemaker, it's the same type of thing, you find it under the skin. So on the scale of surgeries, these aren't terribly painful, but yeah, I didn't know it. So you did two things you probably shouldn't have done. You stopped your pain meds right after surgery. So that was,
Yeah,
tortured yourself a little bit.
well, my defense, I tried to stop beforehand. I was weaning off as much as I could, but
So anybody that's taken pain meds for a while and then you stop, obviously your pain's gonna go up. So,
yeah.
so, but he was motivated to get off and I'm proud of you for getting off the pain meds. That's awesome. So, any other questions? Well, oh yeah, go ahead.
One more, sorry.
One more, go for it.
With me, if I overdo it, I really notice what happens. So I'm on the borderline where I can make myself worse, kind of, on what I do, because I have a little bit of degeneration. When this masks your pain or tricks it, however you call it, how do I know I have more damage coming if it's masking it? If I feel good, I'm gonna do it, like I'm a wrestling coach.
And that's sometimes even with the nerve burning, the radio frequency ablation. that can be an issue in younger folks, because you think, hey,
I know, I look around at your pictures
I'm
and the
in
people in
this-
here, nothing against anybody, but I'm young. So
Yeah.
it scares me to, you know.
And that's where you gotta kind of control yourself, but like Tel said earlier, you will feel some degree of pain, so I think some of it, you gotta just psychologically tell yourself, hey, I probably should
Know what you can
stop.
handle.
Know what you can and can't do, but you'll still have pain, like if you bang your knee.
Yeah, if I bang my knee, it doesn't make all pain go away. It doesn't instantly, I'm not gonna stab myself in the foot and not feel anything. It's,
Like if you blow your disc out, like let's just say above your fusion, a
oh,
little
I'm,
bit more, you'll know that thing won't just mask another problem that's coming. Will
oh,
it?
I'm pretty sure I would. If I twist wrong or if I do something really stupid, like I got a big monster buck during archery season. And man, I hurt the next day when I drug him out and I realized that I probably shouldn't have done that. I have kids for a reason. But that's also me being young and dumb and thinking I can do it because I'm not hurting, and it didn't make my injury go away, but it made it so the pain that came with it constantly did.
Yeah, and I would say when my dad had this done, it took the leg pain away from him. But then within a few months, he noticed a different pain in his back. And so he came back in and had an injection done on top of it. And that kind of cleared that. So it's not, it doesn't really take it away. I think it's like that dull ache that you have all the time. That's what it's taking away, but you can still feel other pain outside of that.
It's called neuromodulation. So again, you're closing the gate to that one particular pain, but it's not like you don't have zero pain. So I think you'll know. You'll know how to limit yourself. Yeah. Awesome. Well, I'll stick around. If you, Ashley?
I think we're good to go. We've got everyone's information. If you didn't get your information, make sure to step out front, and Jocelyn, she's our front desk manager, and she has a team that will call you and just follow up with you to make sure that we can get you in for an appointment so you can ask for your questions with Dr. I or our providers.
Thank you guys so much for coming.
Thank you.
I've seen how many, 20 days,
And
before you even notice it.